The GDR and the FRG had extremely different health systems. The GDR from day one had a nationalized health system. Everything was covered by the state. There were some private doctors. You could go to private doctors, especially through the 1960s, though increasingly they were also nationalized, but it was all paid for by nationalized insurance. The FRG had and has a very mixed system in which basically everyone has a right and actually required to have health insurance, but it works through different systems. It works through your profession, that you are members of these legalized insurance funds, and you get your insurance that way. So through your occupation and profession, rather than having a job per se, the company. It can be public. There are public versions, which would be comparable maybe to Medicaid in our country. And then there are private systems that you can alternately buy or buy on top of one of the other more public versions or nonprofit. So there are different insurance systems. And the Westerman system is very privatized, though a little bit less so now than it was, let's say, in the 60s and 70s. In the 1980s, both systems began to put a lot of emphasis on public health. East Germany had done that all along, but West Germany came in and emphasized that on preventive health care. So that difference between them began to narrow in the late 70s and 80s, with both of them paying a lot of attention to preventive health care. For example, infant mortality, maternal mortality, vaccinations, etc. East Germany had always paid a lot of attention to that. West Germany, its system began to pay much more attention to that from the 1960s onward.